hot summer day, your patient arrives panting heavily, gums bright red and collapsing. The owner says, "We are outside for only 20 minutes." But for a bulldog in 35 degrees centigrade heat, 20 minutes can mean the difference between life and death. Heat stroke kills faster than most toxins, and climate change is making it deadlier every year. I am Dr. Ashok Pattanaik, Head of R&D at Godrej Pet Care. 3 decades of research in companion animal nutrition and physiology has taught me that heat stress is a metabolic emergency demanding immediate evidence-based intervention. With global temperature rising, every veterinarian must understand heat stress management. Today, I will share the science, the clinical protocols, and the nutritional strategy that protects your patients when temperatures rise. Dogs share our food, habitat, and lifestyle, including our climate stressors. But unlike humans, dogs cannot efficiently regulate body temperature through sweatings. They depend on panting and minimal paw pad sweat glands. When ambient temperature exceeds their cooling capacity, hyperthermia develops rapidly, progressing from heat stress to heat exhaustion to life-threatening heat stroke within minutes. Today, we'll examine the clinical presentation, emergency management, and evidence-based prevention strategies, including nutritional interventions that build thermal resilience. Stress is a specific syndrome involving endogenous hormone and nervous system changes triggered by stressors. These fall into 4 categories: biotic like infection, physical like wounds or pain, environmental like heat or cold, and psychological like fear or anxiety. Stress manifests as acute or chronic. Acute stress is short-term, loud noises, brief separation, triggering cortisol spikes that normalize once the stressor is removed. Chronic stress is prolonged exposure causing persistent cortisol elevation, HPA axis dysregulation, and immunosuppression, compromised immunity, and increased disease susceptibility. Heat stress occurs when dogs cannot cool down effectively. Panting and paw pad evaporation fails to dissipate heat, leading to internal temperature rises and hyperthermia develops. Brachycephalic breeds like Pugs, Bulldogs, and French Bulldogs face 146% higher heat stroke risk due to narrow airways preventing efficient cooling. Overweight dogs, thick-coated breeds, geriatric and pediatric patients, and those with cardiac or respiratory disease show increased vulnerability. Environmental factors compound the risk. High temperature and humidity, inadequate shade or water, excessive exercise, and the deadliest, dogs left in parked cars where temperature is 50 degrees centigrade within minutes. Hyperthermia progresses through 3 stages. Heat stress, characterized by increased thirst, excessive panting, increased respiratory rate. Heat exhaustion, evident as heavy panting, weakness, collapsing episodes, and dullness. Heat stroke, the emergency, body temperature 41.1 degrees centigrade or higher, bright red or pale gums, drooling, disorientation, vomiting, diarrhea, seizures, and collapse. Immediate assessment: rectal temperature above 41 degrees centigrade is critical. Mucous membrane color, capillary refill time, and presence of vomiting or seizures indicating multi-organ dysfunction. Heat stroke demands immediate action. First priority is gradual cooling, not ice baths, which cause vasoconstriction. Remove from heat, Wet down with cool water, focusing on neck, armpits, and groin. Use fans for evaporative cooling. Never wrap in wet towels. Transport to the vet immediately. Veterinary management includes intravenous fluids for shock and internal cooling, oxygen therapy, airway support if needed, antiemetics, antibiotics preventing sepsis, cardiac medications if needed, and intensive monitoring of temperature, cardiovascular parameters, and organ function. Severe cases may require blood transfusion and ICU care for 24 to 48 hours. Prevention is definitely preferable as heat stroke mortality approaches 50% even with treatment. Provide constant fresh cool water, adequate shade, cool indoor environments, time outdoor activities for early morning or late evening, avoiding midday heat entirely. Never leave dogs in parked vehicles. Be mindful of hot pavement. If it is too hot for your hand, it is too hot for their paws. For high-risk breeds, consider cooling vests, limit outdoor exposure, and maintain ideal body weight as obesity dramatically increases the heat stroke risk. Emerging research shows the role of nutrition in building thermal resilience. Antioxidants, vitamins C and E, selenium, zinc, omega-3 fatty acids, and polyphenols combat oxidative stress from hyperthermia and protect cells from free radical damage. Anti-anxiety agents like GABA, alpha-casozepine, L-tryptophan, and theanine help manage stress responses. Most promising is gut-brain axis modulation through probiotics and prebiotics. Gut microbiota influence serotonin synthesis, brain-derived neurotropic factor, the BDNF, and cortisol regulation. Probiotics also prevent heat stress-induced gut barrier compromise and bacterial translocation. Climate change makes heat stress increasingly critical. Rising temperatures correlate with increased dog bites and rabies. Extended warm seasons expand vector ranges. More ticks and fleas means more Lyme disease and heartworm diseases. Animal welfare also suffers due to heat stress. 87% of UK dog owners exercise dogs less during heat, affecting their physical and mental health. Heat-related diseases is now a leading cause of death in military working dogs. The veterinary profession therefore must adapt to this changing reality. Building thermal resilience requires comprehensive nutritional support. What Godrej Ninja provides through integrated formulation. Ninja's foundation includes high-quality protein supporting metabolism during stress, balanced calcium to phosphorus ratio for neuromuscular function, and omega-3 fatty acids providing anti-inflammatory support. The 3 P's offer targeted stress management. Probiotics help maintain gut barrier integrity. Prebiotics support beneficial bacteria and stress resilient through gut-brain axis. Polyphenols provide antioxidant protection. Essential micronutrients like zinc, selenium, and B vitamins and vitamin E complete the formulation. This comprehensive approach builds physiological resilience, helping animals withstand thermal challenges. For practitioners, recommending Godrej Ninja means providing foundational support that complements environmental management, building resilience before crisis occurs. Heat stress management is critical emergency medicine. Let me leave you with a few essential messages. First, heat stress progresses rapidly. Acute heat stroke is life-threatening, requiring immediate recognition and intervention. Second, prevention is paramount. Environmental management prevents crisis entirely. For high-risk breeds, extra vigilance is mandatory. Third, nutrition builds resilience through antioxidants, anti-anxiety agents, and probiotics. Comprehensive formulations like Godrej Ninja provides multifaceted supports very efficiently. Fourth, climate change makes heat stress management increasingly critical. Rising temperatures and extreme weather affects our patients even more now. Treatment protocols therefore must adapt to these changing circumstances. Finally, owner awareness is fundamental. Educate clients about risk, prevention, and early warning signs. Heat stress management combines emergency medicine, preventive care, and nutritional support. Master all three, and you will save lives while building resilience. Because in a warming world, thermal stress management is not specialty medicine, it's a core veterinary practice.